Welcome to the Leadership Teaming episode of the West Virginia Expanded School Mental Health Framework Series. In this video, we will take a closer look at building and running effective leadership teams. We will discuss the core criteria of ESMH leadership teams and provide steps to ensure success. The West Virginia ESMH mini webinar series covers 12 topics that will help schools and their partners gain a full understanding of the expanded school mental health model and prepare for implementation. This video is part of that series. I'm Crystal Criswell, School Mental Health Coordinator from the Marshall University School Health Technical Assistance Center in the Division of Community Health within the School of Medicine. This video series is presented by Marshall University School Health Technical Assistance Center, Division of Community Health in the School of Medicine, with funding from the West Virginia Department of Human Services, Bureau for Behavioral Health. Our learning objectives are to increase understanding of how to form effective, collaborative West Virginia ESMH leadership teams and to provide relevant resources. Let's do a quick review of the ESMH framework. What is expanded school mental health? ESMH is a collaborative, multi-tiered framework where schools, families, and community partners work together to improve student mental health supports. ESMH is designed to support all students in developing skills that support healthy coping and good mental health. ESMH addresses the critical link between academic success and mental health, is planned and proactive rather than reactionary in nature. The framework is strengths-based and flexible, utilizing data to build upon what is working in each school. Implementation is led by cross-systems leadership teams at the local and/or county level. ESMH can look different from school to school due to the flexibility of the model, as long as the basic components of the framework are maintained. We will discuss planning and other aspects of the framework in detail in other videos. This video will focus on leadership teaming. The purpose of the leadership team is to guide implementation of the Expanded School Mental Health Initiative. An effective leadership team is critical to the success of ESMH implementation. The leadership team's effectiveness is the number one determinant of the success or failure of ESMH implementation. It is vital that the team includes not only school administration and staff, but also mental health providers and other strategic community partners. These stakeholders all have specific roles to play to enhance student mental health in schools. Remember, expanded school mental health is a shared responsibility and should also involve shared decision-making. What are the core criteria for effective leadership teams? It is critical that a coordinator is identified to facilitate the process and act as the point person for interactions with county level leaders. The leadership team must have the full support of school and district level administration. The composition of the team should be representative of those who are intimately involved in implementation. These are the recommended steps to effective leadership team meetings. Step 1. Build the team. Identify the chair, co-chair, and members. Step 2. Select a location. Step 3. Always set an agenda. Step 4. Consider inviting guests. Step 5. Gain input from all members. Step 6. Record and share meeting minutes. Step 7. Before adjourning, always schedule the next meeting. Step 1. Build the leadership team. Identify the team's chair. Often, this position is filled by a school administrator or counselor, but anyone who is deeply connected to the school and committed to student mental health can take up this role. Select a co chair so that meetings can proceed in the event the chair is unavailable. The co chair should be heavily involved in meeting organization and agenda development and may take responsibility for leading specific sections of the agenda. Recruit team members with the goal of including representation from various disciplines and perspectives. Be sure to include not only school administrators, but also champion teachers, school nurses, counselors, and other school staff. Ask the mental health provider agency, prevention organizations, family members, and other community members to participate. Step 2. Select a location. Choose a location that is convenient for all team members with adequate parking. In-person meetings are the most effective way to build relationships and achieve results. Use a space that is conducive to productive meetings. It is recommended that the space be equipped with a large conference table and plenty of chairs, Wi Fi, electrical outlets, a whiteboard, and a display screen. Whenever possible, use spaces that are free to use or affordable so that more of the initiative's budget can be used for implementation rather than administrative costs. Step 3. Set an agenda for each meeting. Send the agenda to the team members before the meeting so they have ample time to prepare. Help your team members remember by sending a reminder email to everyone about a week in advance and again the day before the meeting. Agenda items should include reports on action item progress. While important but unplanned issues may arise that require immediate attention, do your best to follow the agenda. And finally, as new issues arise, make a list so that those topics can be addressed in other meetings. Step 4. Invite guests. When your team needs stakeholder input, invite them to attend predetermined time blocks so their involvement is focused. It is especially useful to involve youth or family members when working on special projects. Be sure to communicate clearly with guests when inviting them to participate. Provide a description of the topic for which you are seeking their input. If possible, let them know how long you think you will need their help. Step 5. Gain input from all members. It is important that all voices be heard in the leadership team. Encourage participation by using round robin responses, small group discussions, or silent brainstorming. Use open ended questions to encourage deeper discussion. Directly address members who tend to be quiet to prompt them to interact. Step 6. Record the minutes. Assign the task of recording minutes to anyone in attendance. It is best to alternate between members for this task because it can be tedious. Be sure to include a list of action items and assignments with deadlines established. Send a draft of the minutes to the team members for their review within a few days of the meeting while memories are fresh. Set a due date for edits and make sure resource documents provided in the meeting are linked and attached. Step 7. Schedule the next meeting. Before adjourning the meeting, be sure to schedule the next one. It is easy to forget to do so in our busy lives, potentially delaying progress. Make things simpler for everyone by setting a standing date and time. Many choose to schedule a recurring meeting on the same day and time each month. For example, your team might set a standing meeting at 3 p.m. on the second Tuesday of every month. Meetings may occur more or less frequently as needed unless grant requirements state otherwise. Teams in the early stages of implementation or working on special projects may need to meet more often. Those who have been implementing ESMH for several years might decrease the number of meetings each year. The West Virginia ESMH website has many resources and tools for your convenience, including detailed information about our framework, a 10-step implementation guide, approved evidence-based programs per tier for grantees, an extensive resources page, and a news and events page where you can see highlights from ESMH and AWARE grant sites as well as upcoming trainings. We encourage you to check out all our videos on the Marshall University School Health Technical Assistance Center's YouTube channel. Check out our other videos in this series where we explore different components of the West Virginia ESMH framework. Thanks for joining us for the Leadership Teaming video of the West Virginia Expanded School Mental Health Framework.